In the war on drugs, children are often collateral damage. Law enforcement authorities estimate hundreds of Oklahoma children are growing up in homes where illegal drug use and abuse are rampant. Oklahoma City played host this week to a national conference on drug-endangered children. The message was clear. When drug arrests are made, children should not be the forgotten victims.
Law enforcement gets credit for arrest, dope seizures, gun seizures. That's what they get credit for. They don't get credit for saving children.
Dub Turner has seen the damage drugs can do. Turner's career in law enforcement spans more than 3 decades. The education program director for the Oklahoma Bureau of Narcotics calls illegal drugs the nexus of many of the state's ills.
A lot of crime is committed either on drugs or they're trying to get money for drugs. So drugs is kind of the core of a lot of our problems in society. And we need to learn to address that better than what we have.
With the reemergence of methamphetamine labs and the increase in prescription drug abuse, Turner believes the state's top priority should be to address the impact of drug addiction on families.
In 2010, we had lost, in the 2 years prior, we had lost almost 13 children that died or near death because of drug abusing and drug addicted parents. So, we're saying we've got to do something here. We're losing too many children because of this.
Oklahoma began the process of establishing a Drug-Endangered Children Alliance 2 years ago in response to a surge in meth lab seizures in the state. While meth lab busts have declined nationwide, Oklahoma has moved in the opposite direction. According to the Drug Enforcement Administration, Oklahoma had 761 meth lab seizures last year, ranking the state 6th nationally for meth lab bust. Oklahoma Narcotics Bureau Director Darrell Weaver says the rise in meth lab seizures means more children are being exposed to the chemicals and other hazards associated with the labs.
Just within the last few years, we looked at this very closely and realized we really don't have an establishment here in Oklahoma where we're augmenting resources and different disciplines to help these kids. So that's really our motive, to start that up in the last 2 or 3 years, and that's where we're at today.
Weaver says the problem isn't restricted to meth, and it's not just a law enforcement issue.
We can always get that kilo of cocaine. We can always get that large sum of marijuana. And that's important, and we want to continue those efforts. But the bottom line is, if we walk past a child, a 5 or 6 year old child, or an 8 or 10 year old child, whatever, a child in that home, and we really do not take care of that child, then we failed.
A national survey on drug use and health showed between the years of 2002 and 2007, an estimated 2.1 million children in the U.S. lived with at least one parent who abused or was dependent on illicit drugs. Turner says the consequences of those numbers are frightening.
When mom and dad have money for drugs, but they don't feed their children, there's a problem with that. When children live in filth, when they're not taken care of, the basic needs of a human being is being neglected, there's a problem there.
Pat Dameron is Chief Operating Officer for the Child Abuse Response and Evaluation, or CARE Center in Oklahoma City. Dameron says children in homes where illicit drug use or manufacture are taking place are often the victims of neglect.
They may not be being fed properly. We also know that they might be addicted themselves just living in that environment and maybe breathing in, especially with meth, breathing in those fumes. The physical damage, we don't know how long lasting that's going to be, but there is maybe physical damage that's happening by them being in that kind of environment.
Dameron says the habits learned by children living where drug use is common often create a cycle of abuse, passed on from one generation to the next.
In other words, you'll see a family that's got several generations of drug problems. And so you're living in an environment where it's the norm. So you grow up and find that that's the norm for you too, because it's what you've known and been taught.
What many of those children are taught is not to trust anyone.
Little girls can't even have sleepovers. They can't have friends. You don't invite anybody to your house. You don't trust anybody. And I've even had them tell their children, if you tell the police about the medicine that mom and daddy take, the police will put us in jail and you'll never see us again.
Turner says while law enforcement usually focuses on arresting the parents, it became clear to him that a different approach was necessary to address the needs of the children.
I heard about the Drug Endangered Children's program in California. A lady named Sue Weber Brown, who I call the mother of drug endangered children, started the program in California back in the mid-90s. I heard her, and it brought it home to me at the time, a father with children. It brought it home to me, and I was one of those guys that kicked in the door and stepped over the children to get to the parents.
Weber Brown's approach, and a theme heard repeatedly during the national conference and at workshops held around the state, entails a collaborative effort involving law enforcement, the Department of Human Services, and medical professionals.
When we don't sit down and work together, and you guys know this as well as I do, when we don't work together, we don't staff the cases together, that's when these children fall through the cracks.
We bring in all the parties. We all know what each other's doing. We know the case as a whole. And then these cases don't fall through the cracks as easily. We don't lose touch with these children.
Oklahoma has adopted legislation to improve social services for drug-endangered children. Last year saw passage of House Bill 2251, which statutorily defines a drug-endangered child as a child who is at risk of suffering physical, psychological, or sexual harm as a result of the use, possession, distribution, manufacture, or cultivation of controlled substances, or the attempt of any of these acts by a person responsible for the health, safety, or welfare of the child. This term includes circumstances wherein the substance interferes with that person's ability to parent and provide a safe and nurturing environment. The measure also requires the Department of Human Services to investigate cases of drug-endangered children. Weaver says his agency is also developing a tracking system for children in homes where drug arrests take place.
We envision one day of having all of law enforcement just immediately be able to input the data about this drug-endangered child, and it going very discreetly to DHS and that information, and then they can deal with it. Then it go to the medical community that's supposed to look at it. So in other words, there's no holes in the system.
Weaver says OBN will start the program with a few pilot law enforcement agencies before eventually taking it statewide.